Review eBook, Atlas of Clinical and Surgical Orbital Anatomy. 3rd edition Introduction Overview of the book's scope and purpose. Atlas of Clinical and Surgical Orbital Anatomy, 3rd edition, is an eBook that functions as a connected structure of information targeting clinicians, surgeons, or students who may wish to understand the complex work of the orbital anatomy. The book is highly factual given that it provides detailed information regarding important areas of the orbital anatomy that can be useful in the diagnosis of the problem and the nature of work that need to be done. The purpose of the book, therefore, is to simplify the orbital anatomy by connecting important information and explaining the functional arrangements within the orbit in an easier manner. Further, the publication is useful beyond theoretical general knowledge. Its accurate description and presentation of the orbital anatomy can be applied by clinicians for practical purposes. Brief history of the previous editions and their impact on the field. 1st and 2nd editions of the eBook have become vital and enriched space of information in the medical field. The publications have simplified knowledge, especially the first title, Atlas of Clinical and Surgical Orbital Anatomy. The second publication further adds more important knowledge and offers an enabled environment of understanding. The 2 books in summary form have become the overall contributors to education in the field of ophthalmology. Introduction to the 3rd edition's updates and new features. The 3rd edition has continued to build up on the 2 previous literature by adding more information on 500 additional references. Further, the 3rd edition contains practical information containing up-to-date information relevant in understanding the orbital anatomy. This publication also introduces a new chapter, the nasal cavity topic and paranasal sinuses, with better critical relations drawn in to help the clinicians understand possible clinical disorders affecting relevant areas. Author background: Dr. Jonathan J. Dutton's extensive academic and professional background. Thomas G. Waldrop, an expert medical illustrator, has extensively interacted with Dr. Dutton to draw up detailed and accurate illustrations for which the atlas is famous. His work helps present rather complicated anatomical information in a visually appealing way and to facilitate learning and application of it. Summary of their combined expertise and experience in ophthalmology and medical illustration. Dr. Dutton and Mr. Waldrop benefit from together combining a deep knowledge of both clinical and illustrative aspects. It serves to be critical in upgrading the educative impact of the atlas, making it a prime reference in both learning and applying neuroscience-infused modes of ophthalmologic practice. Content overview of the content chapter by chapter. The atlas consists of a number of chapters touching upon the specifics of the cavernous sinus, orbital bones and fat, extraocular muscles, eyelids, brows, and the anterior orbit, and other areas. Each chapter includes a detailed anatomical description and a great quality illustration. New chapters, updates to existing ones. A number of existing chapters have been greatly revised with literature and clinical findings having been updated. Chapter 13 is an introductory part to the whole dark slide, A12, the first one in the bibliography. Hitherto, there was a notable addition in the form of a chapter describing the nasal cavity and the paranasal sinuses. More clinical preparatory information. The 3rd edition is notable for focusing even more on updating the literature review and adds more clinical context to the presentation. Over 500 new references only make it clearer that up-to-date clinical data is of the utmost importance in learning and application of orbital anatomy. Key features and enhancements. New chapter on nasal cavity and paranasal sinuses. Addition of a new chapter on nasal cavity and paranasal sinuses diversifies the content of the book and extends its scope to the crucial domains affecting the health of orbits. This edition will allow the readers to grasp the full range of relevant knowledge and will improve their overall understanding of the anatomical and clinical domains. Enhanced clinical correlations at various places in this piece broaden the reader's insight into how the anatomical structures affect specific clinical conditions. This edition will enhance the accurate assessment of various diseases and the effectiveness of surgery as a cure. Detailed examination of chapters Cavernous Sinus. Importance and description of the anatomical structure. The importance of the cavernous sinus for the venous dames and its relation to various cranial nerves, both in benign and malignant conditions, are the subjects of this chapter. Osteology of the orbit. An appraisal of the bones and their relevance in surgery. This chapter examines the bones that surround the orbit and analyze their relevance in surgery, including the discussion of trauma and reconstructive surgery. Extraocular muscles. This chapter reports up-to-date information regarding the anatomy and function of the extraocular muscles and their relation to motility disorders and the relevant surgeries. Eyelids, brows, and anterior orbit. This part of the book is considerably widened with detailed descriptions of surgical techniques in the domain of cosmetic and reconstructive surgery and serves as a comprehensive guide on how to integrate anatomical knowledge and surgical skills. Histologic anatomy of the orbit and radiographic correlations, enhanced with new imaging techniques and correlations for clinical practice. This chapter highlights several advanced imaging techniques that provide more accurate and clear views of the orbital structures. Types of imaging discussed are CETA system imaging, virtual 3D anatomy of the orbit, and refined images based on real images. Illustrations and visual aids review of the high-quality illustrational images that are difficult to cover with words, further enhance the understanding of these complex structures. In medical microscopy as well, illustration comparisons significantly increase the likelihood of making the correct diagnosis by narrowing down the possible diseases through a process of exclusion. Discussion on the use of medical imaging in the book to bridge theory with practical visual understanding, experience of medical imaging, such as MRI and CT images that can be captured and refined by relevant software and other forms of medical imaging, is incorporated into the book's content. Material makes the equipment and description of its use by healthcare professionals, a part of the professional life of students learning the subject. It bridges the practical portion of medical imaging with the theoretical anatomy within a real context. Clinical relevance. How the book serves as a bridge between detailed anatomical knowledge of the orbit and application. Each chapter is co-written by an anatomical surgery specialist, allowing it to serve as a guide by adding a level of abstraction between theory and practice to generate more accurate results. Examples that display the use of anatomical knowledge for diagnosing and treating orbital diseases. Throughout the book, examples in each chapter, synopsis present the sort of detail required of anatomic research and knowledge, and explain how it is used to diagnose or treat the disease affecting the orbital zone. Throughout the chapters, the book aims to demonstrate a practical application of such expertise. It enhances the importance of pictures in the text. Conclusion. Summary of the book's contributions to the field of ophthalmology and orbital surgery. The atlas serves as a primary source of information that enriches the field by providing an ultimate resource devoted to the concerned concern. Indeed, it enhances the current understanding and may act as an informative addition to an educational schedule. It supplies valuable theoretical context and new solutions for the challenges that ophthalmologists could face in a professional activity. Given its content and purpose, the atlas may not be used as a primary educational material cause of its focus on case studies and practical applications. However, it can greatly support the educational goals and be useful in a practice. Final thoughts on the book's place in ongoing medical education and professional development. From this perspective, the atlas experiences best fits both as a substantial tool of ongoing education and at professional development. The latter may include not only the changes in the clinical practice caused by the introduction of the novelties, but simply maintaining the practitioners in these specialties' frontiers. The atlas is highly recommended to be used at all stages of education and by any practitioner dealing with the orbital region. References that are used throughout the book and their citing in the text of the given atlas ensure that the all information is backed with a solid scientific ground. As a result, all case studies will be relevant as well as the solutions for all the problems posed.